I had to surrender and actually acknowledge that I was feeling afraid. Mm-hmm. Acknowledge that I was feeling angry, that I was feeling like, why me? Yes. Because I didn't have anybody, right, that completed suicide in my life. I do have a father, however, who is a Navy veteran who did attempt suicide when I was only 12 in front of me.
Welcome to the LHP podcast. In this week's episode, we have something very special lined up today. We're going to talk about something that's extremely difficult to actually talk about, but at the same time, we're going to do everything possible to be very empathetic about the approach, because a podcast having to do with this subject can be a little delicate and can be a little difficult to actually listen to. I want to start off with a quote from one of my favorite bands, Blink-182. They wrote a song called The Atom Song. And the opening verse of that song says, "I never thought I'd die alone. I laughed the loudest who'd have known." And that basic lyric right there hits so many in so many places, because of the fact that we see a lot of people that are actually suffering, but they don't really say much. They don't speak out about it. And just like with personalities that we've seen over the years, like Anthony Bourdain, or maybe even some musicians that are near and dear, like Chester Bennington from Linkin Park. These were people that were very talented. They communicated very well, but at the same time, a lot of times they just had a hard time really expressing their emotions. So this podcast is going to be dedicated to that. And our guest today, I think her presentation was probably one of the most dynamic presentations that I had ever seen. And I feel that everybody in the city should see this presentation and hear her voice, because it's a voice of reason. It's a voice of empathy. It's a voice that really gets us engaged to being able to open up to this topic without feeling that fear of opening up wounds. She does it in such a dynamic way. Jeanette James has been doing this for over a decade. She does online therapy. She's been working with some of the most recognized mental health clinics here in El Paso, and I'm really happy to have her in the studio. She's going to talk to us a little bit about herself and what she does with our community. So, welcome, Jeanette. Thank you.
Thank you. It's my pleasure to be here with all of you today. I definitely want everybody who's listening today to, sit back and really listen and really take the time to hear, really listen what we're going to be saying today, because I think that so many people out there are suffering. You use that word in particular. And I think that a lot of us don't want to speak up because we're afraid, right, that we're going to be a burden to someone. We think that, why would I tell another person what my pain is, what my hurt is? They're already hurting. But the reality is that as a cumulative, right, we're here to help. And that's our goal today, is to actually help those listeners that are out there. So a little bit about me. I'm Jeanette. I'm a human being, first of all. Mm-hmm. I am a licensed professional counselor supervisor by trade. I have worked, as you mentioned, right, with several different places. Currently working at the Stephen A. Cohen Military Family Clinic at Endeavors remotely as a clinician for the San Antonio office. I've worked for the El Paso office as well. I've been with El Paso Behavioral Health Systems, and now I'm also the owner of Aligned Empowerment PLLC. So I do have my own private practice. I have worked as well with Fort Bliss, with the immigrant children that, crossed over, and doing crisis management with them. And so I've dipped my hands in a lot of arenas when it comes to mental health, and not just in clinics, because I think that mental health is not just in a clinic. It's not just, in a hospital. It's in every single one of us that live on this world. Yes. I think every single person, and I can safely say that, have been impacted in some way or another with mental health issues. And the topic that we're going to be previewing today, I can definitely say as well that either we have seen it, we have heard it, or we have even lived it very close and dear to our hearts. And that topic, and I'm going to initiate that word, right, is suicide. And I think that when we bring forth that word, it can definitely bring a lot of confusion sometimes, a lot of mixture of emotions. And when we think about, right, suicide, we think of so many different people. And I mean it, from children all the way up to elderlies that may have, right, taken that decision to end their life. And even as I say that, right, I'm very cautious in saying that because we truthfully don't ever know what was going through the mind of somebody who took their life. That's like the $1 million question, right? Did they make the decision to take their life? Did they accidentally take their life? Was it even an actual suicide, right? Where they actually completed suicide? So that question in itself arises in the minds of every single person who at some point has been impacted by suicide, either again directly because they had a family member or friend that completed suicide, or we hear it on the news almost every single day.
Yeah, yeah, it's definitely something that that is very difficult to talk about, and you're completely right when you talk about there's so many people that have been impacted by a choice, right? And it's kind of unfortunate because a lot of times what we see is a lot of people are very judgmental when something like this happens, and I think it puts people in a situation where all of a sudden they just close up. They close that door. They don't want to talk about it too much. And in your practice and in your experience, what's that been like?
There's definitely a lot of taboo. There's definitely a lot of fear involved. There's a quote that in the presentation that you previewed that I love because it says, "I believe that the person who commits suicide puts his psychological skeletons in the closet, in the survivor's emotional closet." And that couldn't be more true because there's so many unanswered questions, because when we're talking about a suicide, we're talking about a traumatic loss, a traumatic death. So the people that are left behind, they're left with the question of why? How could they have done this to themselves? How could they have done this to me? Why wasn't I enough? Was I even enough? Did they even think about me? And there's a lot of anger, there's a lot of guilt, a lot of shame behind talking about the aspect of this word, right? Suicide.
Mm-hmm.
How do I tell a person that my mother, my father, my aunt, my uncle, my child
Mm-hmm.
completed suicide?
Mm-hmm.
And they disguise the word, right? Or they're afraid to even talk about the word. And we create this distance from other people because I feel embarrassed.
Mm-hmm.
I may feel afraid. I may feel completely like I'm not going to be understood. And the unfortunate part of that is that that may be true. Sometimes people lack the ability to understand another's suffering because we as human beings, right, want to make sense of something that doesn't make sense at all.
Powerful.
Yeah.
Yeah. How do we teach people how to manage and what are your techniques that you use to be able to kind of open up a discussion on that? I mean, during the podcast, we're going to talk about different methods that exist out there, but I think the most important one at the beginning is building rapport with the client, right? Because
Absolutely.
if you think about it, it's like, okay, I'm going to this clinic or I'm going to this hospital and I'm going to open up about something that's extremely difficult to even think about. So how do I begin that? How do I go to an office and sit down and talk to Jeanette about something like this?
I think one of the things that I want to first say, right, not just for myself, but even for other providers that are out there that are listening, for human beings, right, that are listening, is that when somebody has lost a person, somebody who's dear to their heart, who meant something to them, you first have to remember that you have a human in your office. They're not broken, so they're not there to be fixed by us. And unfortunately, right, sometimes the ego side of the helper wants to just fix and take away that pain and the hurt. And we're doing them a disservice because we want to allow them to tell their story. We want to allow them this space to actually show us their emotions. Of course, we want to get them better. We want to get them functioning. If they're not functioning, we cannot do that if we don't take the time first to actually create rapport from their human side. We don't want to create that barrier of I'm the therapist or I'm the social worker and you're this client that's right here and there's something wrong with you because somebody in your life committed suicide. No, it definitely has to come from the standpoint of I want to understand you first from the human side and what is your pain? What is your suffering? That can even be complicated if the person who actually completed suicide was somebody who maybe abused them, was somebody that maybe they had just had a fight with. And then there's so much guilt and blame, right, coming through at that moment, not even because of the loss, but because of the traumatic experience that comes from what led to this, right, completed suicide. The imagined scheme that they tell themselves in their mind. And then that even gets more complicated, right? With did I actually see the suicide attempt, right? Did I actually see the completed suicide? Or am I now creating this story in my head that is even worse sometimes than what truly happened in physical form?
And this goes back to the same quote that you just mentioned right now in the presentation. I think that quote is extremely powerful. And when you talk about that also, it's like you have the survivors now, and then they're asking all the questions. Did I have something to do with that? Did I cause it? Did that fight that I have last night or me being unable to provide certain elements in their life trigger them to do such a thing? Because these are all real questions that a lot of people are asking themselves, right?
So there's three primary questions that are very unique to the processing of a completed suicide. And I want the listeners, right, to really listen, hear, and really embody these questions. And if you can relate to this, know that you're not alone because this is unique to when we're talking about, right, suicide. And that first question would be, why did they do it? Why did they do it? I mean, they're gone, right? They can't answer us. They can't tell us why did they do it. So this one question, right, can lead to a lot of chaos in somebody's mind because they're trying to become like a detective.
Yes.
The problem is that there's nobody to actually give you, right, the responses. So that can lead into a lot of anxiety, right? A lot of depressive symptoms because it doesn't make sense. That leads into the second question, right? Why didn't I prevent it? So there's a lot of guilt, inappropriately assigned guilt, right? Because somehow I should have known, I could have known, if only I would have done this. Like I should have had this crystal ball and know that this person was going to do it. And I could have stopped him. I should have done something to stop it. And that, right, can be consuming to a person. It takes over their entire mind, their entire life. They stop functioning because their sole purpose is to somehow understand, right, what more could I have done? And this doesn't just happen to family. This can actually happen to a lot of mental health providers out there in the community, right? When they hear that one of their clients actually completed suicide. They go into their desk, right, and they're scrounging through notes and they're reading every single thing. And what did I miss? What did I do? And yes, of course, from the standpoint, right, of a mental health provider, there can be legalities even attached, right, to somebody ending their life.
Yes.
So that creates, right, a new dynamic of help. And there's maybe even fear in helping as well. And then the third question, right, how could he or she do this to me? Because yes, a lot of times, right, people invest their time we're never going to get back, their love, their care, money, resources of all kinds, in helping their loved one who maybe, right, showed signs before of wanting to end their life. But that's not always the case.
It's not.
It really isn't, and I've heard erroneously a lot of people say out there, well, somebody who's going to, commit suicide, they've made up their mind and that's it. It's done. It's over. There's nothing you can do. No, there's a lot that you can do.
Why do you think people have, or that notion that that's what they're thinking? Where does that come about?
Believe it or not, it's actually a way of creating this protection, right? This facade of safety in wanting to make sense of something that does not make sense. And remember that when we're talking about suicide, we're talking about two things. Number one is the loss, and number two is the trauma that comes from such a loss. So if I convince myself, right, that somehow there's an explanation, then my mind can wrap around that loss.
Yes.
So it's an avoidance, believe it or not, right? It's an avoidance of actually not knowing, and the pain, the hurt, the confusion that comes with not knowing. Because as a human being, I want to know. Most of us are, if I see it, then I believe it, right? So I didn't see it. I learned about it. So how can I even believe that this happened? There must have been something, right, that wasn't sufficient to hold him here in his life. And so that's where that question comes in. Now, there's a fourth question here in Texas, right? It's not allowed legally, assisted suicide. However, we do have people here in our community that have, come into El Paso, or maybe they do come from places where assisted suicide is actually possible.
And for those that are listening right now,
Yes.
what is that?
So when we talk about assisted suicide, right, it's somebody who maybe potentially would be nearing their life because of a medical condition of some kind. Maybe there's something going on. And so then a medical professional, right, where they're actually allowed to assist the client in ending their life rather than going through the motion of waiting that disease to take over. And so that can be done in different ways, different methods. And when somebody's family member, right, maybe was there present, it's a confusion still in having to respect that this person, right, is choosing along with the medical provider to terminate their life because they don't want to go through this process that is still pending.
Yes. And it's also difficult.
Very difficult because it still goes back, right, to this mentality. And I can tell you that just recently, like last week recently, I had a client, a female client, whose mother actually completed suicide and her brother completed suicide about a month apart. And the biggest question for her, once again, right, is why didn't I prevent it? Another question that came in for her is, my mom was very religious, of Catholic upbringing. She would tell me that committing suicide was a sin. So how could she go forth, right, and do this? Because then she's creating this chaos in my mind that everything she taught me is not true. So it can also create, right, a question in your own perspective of who you are.
A conflict within.
Yes, a conflict within. And so it robs, that's the words that I hear a lot from my clients, right? They robbed me from my identity. They took something away from me that was mine. And one other aspect that I see, right, is that the question comes with questioning who that person was. So for her, right, this was my mother, but then if my mother actually completed suicide, then I don't want her as my mom, right? And that's a very hurtful, very painful statement to even have. It's a reality, right? So believe it or not, there is in research a difference between the way a female processes the loss versus how a male processes the loss. And in males, we see even more that rupture, that if their mother actually completed suicide, they feel completely unrooted. They feel like they lost their whole identity.
So do you see in many of your cases that a lot of times what happens is that if they see a family member complete suicide, do you think that there's a big possibility that they're going to follow in those footsteps as well?
So when we look at research, right, there's definitely evidence that somebody who has had family members that have completed suicide have a higher risk in them taking their own lives as well. Now, I want to say this and say this loud and clear. That is not always the case,
Okay.
right? That's a statistic because of research that has been done. That doesn't mean that anybody listening has to be or is going to be a statistic.
And I'm so happy that you're mentioning that, because a lot of people that are listening to this, like I said, they can, they can be confused over that. But I'd like for you to talk to us a little bit more about that.
Yeah, absolutely. I mean, now we bring in, right, the feelings that are experienced by somebody who survives someone that completed suicide. And that first one, right, predominantly is shame. So I urge those of you that are listening right now, right, ask yourself, what is shame to me? I don't want the Merriam-Webster definition, right, of what shame is. What is shame to you?
Personalize it.
Yes. And I think that that's so important, even when you are treating, right, a person who comes into your office space. And even if you're not a treating provider, right, but you're their friend who maybe is listening to them, don't try to tell them that you know better than they do. No, you don't. The person who knows themselves the best is that person that's sitting across from you telling you their story. Listen, ask them, right? What is shame to you? What are you feeling?
Now, when you're saying this, when you're asking people this question, do you advise for any family member to do this, or is it something that as a therapist you would take those steps to open up a conversation?
So as a therapist, I would definitely take the step to open up that conversation. Now, the ideal scenario, right, would be for somebody to be in an office with a professional. The reality, though, is very different. Mm-hmm. So I want to open this space up, right, to equip people that are listening, not just professionals, to know how to have these conversations when somebody comes to you, and understand, right, that you're not a mental health professional, but you can do a lot of healing for that person just by sitting and listening. You don't pretend that you're a therapist, right? You listen, you give them the space to actually use you as a sounding board, because sometimes the mind just needs to get it out.
And a lot of people want to be able to offer advice. A lot of people want to be able to make an impact right then and there. They want to say, hey, maybe what you're feeling is not what you think. Let me go ahead and provide you with some information on your own emotions, right? And that's where they confuse people instead of just sitting there. How difficult is it, Jeanette?
It's very difficult. It's very difficult because I'm going to share with you, right, the reason us humans do that. And the reason why we do that is because we feel discomfort within ourselves. We have the distress of not knowing how to handle that emotion. So by instinct, we want to wrap our arms around them. We want to say, like, don't cry. It'll pass. It'll get better. We say insensitive things because of our own discomfort with our feelings. We stop being present for that person the minute that we allow our feelings to take over. If you're going to sit down, right, and give this space to someone, then you have to remember this is not about you. This is about them. If you see them, right, in dysfunction where they're not showering, where they're not eating, where they're no longer living life, then of course we want to have that conversation to encourage them to seek the help that they need from a professional that can help them get out of that state of where they're at.
Do you think that those are the classic symptoms, or do you feel that, even though they're functioning and nothing is happening and, they're going about their usual day, you don't see any of the signs and symptoms? Is that also something?
Yeah, Absolutely. I will say that not everyone, right? But there can be such a thing as avoidance. Remember that I talked about, right? Two concepts: the
Mm-hmm.
loss, the grief, and then the traumatic loss.
Mm-hmm.
So, for those of us, right, that understand the DSM 5,
Mm-hmm.
the actual diagnosis of post traumatic stress disorder,
Mm-hmm.
suicide, right, and who survives that completed suicide can definitely show signs and symptoms very similar to that diagnosis of post traumatic stress disorder.
Mm-hmm.
And the number one, right, symptom of that is avoidance. So I'm going to go embed myself in work and I'm not going to think about it. I'm not going to talk about it. I'm not going to do anything that could potentially, right, bring back the memory of this person.
Mm-hmm.
So I'm going to avoid people, places, conversations. We're not going to talk about it because I'm good.
Yes. Mm-hmm.
The thing is, right, that the more we avoid, the more we're hugging that, the more we're attaching to that.
That seems to be something extremely
Oh, yeah.
common right now with people avoiding that,
Yes.
right? Especially with all that we've been through with the lockdowns and all that, right? It's
Yes.
just people just wanting to consume themselves in things where they're not having to face the reality of life, the challenges, the frustrations, the struggles. Those are all things that as humans we have to learn how to kind of go with the flow with that. How do you help clients get recognize those emotions?
So I think that a lot of what we learned in COVID, believe it or not, right, is that we don't do good at the expression of our feelings. Most of us know emotions, right? We know sadness, we know happiness, we know disgust, we know anxiety, right, or fear.
Mm-hmm.
There's 8 primary emotions that the majority of people know. But there's an intensity to each of those emotions, right? Which brings about those feeling words.
Mm-hmm.
So if I don't have the ability to actually point out what I'm feeling, how can my mind even know what that thought really is that's linked to that feeling? So I can't even express it.
Mm-hmm.
I've had clients in my office who literally all they do is sit down and there's tears streaming down their face and they
Without saying anything.
without saying anything. And most people, right, might get really uncomfortable. And the first thing people want to do is they want to reach over, right, here's a Kleenex.
Mm-hmm.
No, I'm not saying be insensitive, right? But that's why you place your Kleenex box next to them
Mm-hmm.
so that they can reach when they're ready to grab a tissue. Because believe it or not, you can actually interrupt somebody's processing just by you reaching over because it's your discomfort once again, right? Coming and telling them, shut it, close shop. Here is this tissue, wipe down your tears and let's stop.
Mm-hmm.
No. Sometimes they genuinely need to cry it out. And all they may need is just your physical presence because they don't want to feel alone. That brings us to that second feeling, right? That is most
Mm-hmm.
commonly experienced by survivors, which would be guilt. And that's because it's a gnawing feeling. And that word, gnawing feeling, right there,
Mm-hmm.
consumed that there's something they should have, there's something that they could have done. It becomes very personal for them. So why would you want to take away, right, that expression for them?
Mm-hmm.
Expression doesn't just have to be talking, it could be crying. It could be done through dance. It could be done through exercise. It could be done through a lot of different ways: cooking, cleaning.
Mm-hmm.
But you've got to help them to connect right purpose to this thing that they're feeling
Yes.
because it can be terrifying. It can definitely be very, very terrifying for them to do that.
It can be extremely difficult, especially if it's happening to family and with our teenagers right now. Because I think a lot of things that are happening right now, Jeanette, is the use of phones is really I think taking a toll on the minds of young children and everything that they see on perhaps social media sites and seeing the fabulous life that friends and others are living, for example, maybe can take a toll also on the way they think and see their life. They're probably thinking, well, look at all these people having fun with their lives. Look at look at them taking vacations. And here I am, right? And everybody has a nice car, or everybody has really good looking friends or what have you, right? Do you see any of those type of things also in your
Yeah,
practice?
absolutely. I don't just see it with teens. Believe it or not, right? I see it even with children. And there's a lot of jealousy, right, that comes through. And jealousy is actually what we call a compounded emotion, which means that there's anger that's underlying, right, in jealousy. And believe it or not, there's actually sadness. Anger, the difference, right, is that it's sadness turned inside out and then it's attacking me. What the world sees is me being a person who maybe is irritable, who's yelling, who's screaming, who doesn't do their homework, who wants to be aggressive in some way or another. And we misunderstand that we're allowing these things to be fed into their mind. TikTok, right, is one of like those favorite things right now. It's hot.
It's got a lot
It's
of people
hot
on their
topic.
phones. And,
Yes.
that, I don't know if you've seen that documentary, The Social Dilemma.
I have not.
Yeah.
No.
Jonathan Haidt, a psychologist from Harvard, talks a lot about, he puts a lot of emphasis. Who is the product? The product is not actually the phone or the actual app. The product is you. So how it stimulates the dopamine, all those chemicals, and how it functions to keep you making sure that you're always looking at the phone. I mean, it's definitely
It's addictive.
Yeah,
right?
extremely.
It's addictive because in the brain, especially in the developing brain, and I want you guys to hear that word, right? Developing brain. Children's brain is still being developed. Teenage brain is still being developed. When we go through trauma, guess what? Our brain is still developing. So anything we feed, and I want to make sure that I say this too, right? Not all social media is used in the wrong way. I mean, this is why we have a podcast, right? It's being used in a healthy way.
Definitely.
Yes.
We have to really,
Yeah.
really throw that out there.
So I want to make sure that everybody understands the point of what we're saying is not that social media is the root of all evil, and that there's things that are that it's just going to cause chaos. No, but it's understanding the impact of what it's doing to your child, to your teenager, right? Are you noticing these signs where they're more angry, where they're more withdrawn, where they're only in their room, where they stopped connecting with friends? Maybe their eating patterns have changed as well. Their behavior, right? When a child's behavior or a teenager's behavior just changes, there is a reason. All behavior has an explanation. And I will say that again. All behavior has an explanation. And that goes for a child, that goes for a teenager, that goes for an adult. The problem comes back with, I make it about me. I personalize it on me. My child doesn't like me anymore. My child thinks this home is boring. Maybe he or she does, because they truly see, right, what you talked about. The facade of the way that other people live their life. Maybe they did take this great vacation, but you're not seeing, right, all the fights that they had all year long.
Process, right?
Yeah. I mean, people that fight, right, that have chaotic homes, they still go on vacation. They may have money, they may have luxurious cars, or they may not. They may be very poor. I see people in my practice, right, of all socioeconomic backgrounds. And they do have, right, this facade. And they even tell me in session, like, everybody outside thinks, right, that we're this powerful couple that is perfect. And if they only knew the disarray that we have. Sometimes not even their own families know. And I can attest to that, right? Because I work with people like this. And it's not to fault them. It's because, again, going back to that inability to express, they don't even know where to begin to tell people, hey, we're not this facade that you're used to seeing.
Yeah.
Judgment, right, is what they fear.
And you're talking about, adults, right? Which is, I guess, a little, I'm not going to say easier, but when you talk about like kids, for example, it becomes more complex with the fact that not only are you battling against the electronic devices, but you're also having to distinguish what's going on also at a level of growth and development as well. Those hormones, the estrogen, the testosterone, all that is a major factor in the way kids think and feel. And it's an avoidance as well. And then all these models that are popping up on social media, and I want to be like that also. And we all have different genetics, and sometimes we have a difficult time understanding that we have a body that we have to accept, right?
Yeah, and that brings a lot of shame, right? So if you hear what I've been saying, shame and guilt is present in more than just somebody who actually took their life. It's more than just present in the survivor. It's present in our daily lives. There's so much shame and so much guilt that we are exposed to because of what we see. One part of me outside, right, from being a mental health therapist is that very recently I allowed myself to become a model.
Okay,
Yeah, and I actually am into pageantry. I'm Mrs. West Texas 2023.
Congratulations.
Thank you for that.
And this is something new.
Yeah, this is something completely new. And I say that to you guys because you hear that candidness in my voice, because I was that person that assumed, right, that a model looked a certain way. They had a certain height, a certain size. So I can definitely say, right, I created judgment for myself based on what I would see. And I dance as well. I love Latin rhythms. And recently I had the opportunity to dance for Dancing for Kids' Sake 2022. And out of that event, they took some pictures, and somebody saw one of my pictures and they said, have you ever thought of, doing modeling or going for pageantry? Believe it or not, right? The first thing I was like, are you crazy? No, of course not. I didn't think about that. But then I stopped for a moment to really think about, what really is behind, right? Modeling in the way that now the actual community of modeling is moving towards, which is to be creators of change.
Yes, definitely.
Right? They have the connection in the community to be a voice for maybe somebody else that does not. And that can include, right, actually teaching people about body shaming and teaching people about wellness and so many different aspects that can come from being an ambassador of change in your community.
How did it make you feel when you got into modeling, Jeanette? I mean, because like you said, I was like, okay, let's do it. Somebody said, I'm going to go ahead and do it. How does it make you feel that?
I love the empowerment that goes with it.
Yeah.
It's something very different. And it has allowed me to connect in different ways because I think that, when somebody comes into my office, they see the professional, right? But guess what? I'm a human too. I suffer. I have pain. I've gone to mental health myself, right? To receive help when I needed it. I've had coaches as well when I needed them. So what better way to give back than by becoming an ambassador and really teach people about the things that I've gone through? And that if I can give you a little bit of my experience to lessen your pain or to point you in the right direction to get help, why not? So I took it as an empowerment for me. Here I am, and I'm 39 right now, right? Most people, again, do not associate 39-year-olds, right, with being a model or being in pageantry. But for me, it was such a unique opportunity because here I am with wisdom, with guidance that maybe other people don't have because they are younger and because they haven't gone through the experiences that I have. So it was an open door. And one thing, right, that I want to say to our audience today is that every single day, you have the choice to wake up and actually see things as an opportunity. You can choose to sit back and be like, nope, not doing that, right? Or start being that person that gives more yeses rather than nos.
What does it do to your brain chemistry when you engage in something that you thought you would never do? How does it make a person feel? I love what you're talking about. We got off to a very serious conversation.
Yes.
And I just love the fact that we're having this conversation, and all of a sudden we're talking about the chemicals in our brain and how it makes us feel. I think it's important for us to discover those things, because sometimes we find ourselves in some sort of rut, maybe, or it could be
Yes.
routine.
Mm-hmm.
And then all of a sudden we try something different. How does that make us feel?
So it's interesting that you say that, because part of the reason that I got into dance, right, which led into my journey of modeling, was because I was that person that was feeling like I was in a rut. You know, I went through a very serious car accident in 2021 that actually left me with a traumatic brain injury. And I had a torqued occipital nerve and I had dysfunction in the thalamus. That led from literally one day to the other. I started having very severe panic attacks. I started having very severe anxiety attacks. Mm-hmm. At first, right, the first thing they did was, let me give you medication. Let me tell you, I'm not opposed to medication for those that truly need it. Mm-hmm. I felt completely disappointed. I felt like a bucket of water had just landed on me, because how could this mental health provider all of a sudden be taking these medications? Yes. And there was judgment, right, immediately poured upon me.
And you were baffled.
Yes, I was baffled. I didn't understand what was going on. I couldn't make sense of it. And I share this with all of you guys because even though, again, we started talking about suicide, right, and we're going into life, it's because real life circumstances can lead into a sentiment of hopelessness.
Yes.
And so for me, I've never had suicidal thoughts, but I can certainly say that when I started having these severe panic attacks, I felt burning in my brain, burning in all extremities. That definitely left me feeling hopeless. I remember having days where I was crying.
Yes.
Where, my mother would hold me because that's all she would know to do. They would give me these medications that weren't doing anything until I started, right, to observe my own behaviors, believe it or not, with food. So my body developed an actual sensitivity, which is very different than an allergy. And it started attacking my own body. And it was with foods that people claim are healthy: salmon, mm-hmm. eggs, pecans, pistachios, lemons, yellow lemons.
They were having a negative effect on you.
Completely. Every time that I would eat a grape or that I would have a piece of meat, it definitely led into a severe panic attack.
Okay, so diet is definitely something to look out for.
Absolutely.
Why don't people, instead of just making the correlation of physique, look at the fact that it affects your psyche as well?
It does. It does. And, unfortunately, there's not enough information out there. There's definitely not enough knowledge to understand that food can actually, because our stomach, right, is our second brain. Mm-hmm. Serotonin actually lives in our stomach. Yes. Right? And then in the stomach, we have the vagal nerve, which is connected from the stomach all the way to the left side, right underneath the earlobe.
Now, during your presentation, you had mentioned something so beautiful that I think people should know about also, mm-hmm. to feel better, right?
Yes. Mm-hmm. Yes. And so when it comes about, right, that the vagal nerve mm-hmm. is not receiving that proper nutrition. So if there's actual food that are creating chaos in your stomach, mm-hmm. then you're not getting that serotonin delivered into your brain. So it took, believe it or not, from 2021 to barely in 2022 of July for me to discover that if I would have gone to a psychiatrist, which is where they were leading to tell me that I needed to go there next, mm-hmm. because I'm telling you, they would do, I had a cardiologist, I had a neurologist, I had every doctor you can imagine, and all my labs were normal. Mm-hmm. Until I finally found my chiropractor here in El Paso is a functional medicine doctor. And I went into his office and I see this poster that says, if you have panic attacks and if you have burning and if you have this and if you have that, let's get you tested for food sensitivities. And I was like, let's do it. Where do I sign up? But it's so expensive. It's not readily available. And I'm going to be honest, because I think people need to know. The test itself cost me $3,000.
That is really expensive.
It's beyond expensive, and that was like the more basic type of test. But that led into my journey of understanding, right, the severity of how food can actually replicate anxiety and can replicate depression in someone's body. Because the sensitivity can actually lead to seizures. It can lead to cancers. It can lead to all these things, right, that we're talking about can actually lead somebody to end their life. I felt dead, even though I was very much alive. And it wasn't until I got this test, right, that promised me that it would tell me 192 foods that I could eat, that I would never be able to eat, and that I maybe would eat. How do you explain, right, that I was at my heaviest, 212 pounds, and today, right, I sit here in front of you at 137 pounds, and no, that's not because I went to the gym and, spent and worked out. Yes, I go to the gym. Yes, I dance. But it was because my body had inflammation that was producing inflammation in my body. So I wasn't fat. I was inflamed and fat, right, probably. But at the same time, believe it or not, even worse, right? To a psychiatrist, to my own MD, I looked like a bipolar patient. I would have been given a label inappropriately because somebody chose to give up on me and not actually figure out what was going on. But I chose not to give up on myself. So the point, right, of this conversation, of this part of this podcast today is not to deviate away from our conversation and the seriousness behind suicide, but it's to connect you to the fact that you don't want to give up on yourself, right? You don't want to give up on yourself. And there's always answers out there. There's always a way to move through life, even when something seems so hopeless. And that if you're that survivor, right, of somebody who actually completed suicide, there's so many things that you can do for yourself. It's not just about therapy, right? It could be through movement like dance. It could be through changing your diet, through exercise, through so many ways that one can lead to another. What I did do, right, is that I allowed myself to express, and again, the last two feelings that are most commonly expressed by somebody that has lost somebody to completed suicide is anger and fear. I had to surrender and actually acknowledge that I was feeling afraid. Acknowledge that I was feeling angry, that I was feeling like, why me? Because I didn't have anybody, right, that completed suicide in my life. I do have a father, however, who is a Navy veteran who did attempt suicide when I was only 12 in front of me. So I can still have all of these things that I've been talking about without my father having completed suicide, but it's embedded in my mind. How could my father, right, do this to me in front of me, and why would he do that? My father, I kid you not, my father at his heaviest weighed about 345 pounds. His voices in the den, right, would tell him to kill his family. He would see things even as much as a hallucination of a train crossing in front of our home, blood on the walls, which is very typical for somebody who has schizophrenia or even schizoaffective disorder. And schizoaffective disorder, right? For those of us that don't understand what that diagnosis is, it's that hallucinations, potentially even delusions, right? The paranoia, along with a mood disorder. And it could be depression, and it could be anxiety, or even a mixture of both. So there's mood instability accompanying these psychotic symptoms.
We're going into a lot of information that the listener is going to have to process, right? And we're definitely going to have you on the show again for sure.
Let's do it.
I know Arturo just turned around right now and said, hey, we got about 5 minutes to wrap this up. And one of the things that, and I want to thank you for sharing all that you've shared, but for real, we do want you back on the show, and we have to do a second part. No ifs, ands, or buts for sure. But eye movement desensitization and reprocessing. Could you briefly explain that to us?
Sure. So eye movement desensitization and reprocessing, or EMDR as we know it, right, is one of the many methods that can be used to process a traumatic loss in somebody's life. So it's the REM sleep, right, that's being accessed while we are still awake. Now we're discovering more now, right, as we've gotten more advanced in EMDR practices, where we practice something called, right, the dual stimulation. And what that means is that I can use eye movements. I can use what we call butterfly hugs, so movement in the body, tapping left to right. So it's that dual attention that we give that allows the brain itself, right, to actually reprocess an event and either minimize or completely eliminate or transform that feeling that we've attached to a traumatic experience.
Does it work?
Yes,
Okay.
absolutely, it works.
Now, I'm a big fan. The only thing is that for the people listening, I want for them to see your input. I want them to hear what you have to say about it. So thank you.
So EMDR, and I will say this, right? When a clinician is trained in EMDR, they actually have to go through the process themselves, which means that we actually have to do the processing. We become the patient, we become the client. Of course, we do it with something small, right, during the training, but there's no such thing as a small trauma, because trauma is trauma, right? We define if something is very big in our life or it's small in our life, or how it impacts us. And I have seen, right before me, people literally tell me, I felt, Jeanette, like you were in front of me with a bucket of popcorn watching me get raped. And I leave, right, a pause there, because that's such an impactful thing for somebody to say. And the first time that a client said that to me, I was like, wow. Because in that moment, right, they're reprocessing. We're not re-traumatizing. We're reprocessing that visual that has kept them stuck for so long. And the same thing can happen for somebody that has actually lost someone to completed suicide, because they may have seen it, or again, it can be an imagined, right, situation. The actual beauty of EMDR is that it's not a talk therapy, right? Which means that I don't have to necessarily go and spill everything out. Your brain is so beautiful that it can actually spit out to you exactly what it needs in order for you to heal that part.
Yes. And this is why I really enjoy the works of Dr. Bessel van der Kolk, because he talks a lot about how you could feel it in your body as well. One of the things that I did notice also during your presentation, and I want to use this to wrap this up, because we've had such a very interesting discussion today, or presentation, or podcast, is the massage of the vagal nerve, right?
Yes.
Can you talk to us a little bit about that?
Absolutely.
Because this is something that anybody can do at home.
Yes, and we want to give you, right, things that you can do at home and that are simple. So the vagal nerve stimulation, and remember, I said the vagal nerve runs from the left earlobe all the way down into your stomach, is crucial in regulating our emotions. So one very simple technique that you can use is the massage of the vagal nerve, and you can do that in various ways. So the first one, right, would be to squeeze right between your earlobe all the way down into your shoulder blade, almost like it's an orange. So if we squeeze, and I don't know if you can see me, but you can squeeze gently as you're talking about a traumatic event, especially those that are guilt-driven and shame-driven as well. Now, if touch is not something you want, because a lot of people don't want to be touched even by themselves, then we can actually do the same thing by humming. So, or my third and most favorite, singing. Singing is the biggest stimulator of the vagal nerve. So if you're feeling down, you're feeling depressed, sing. Get up and sing. Sing as loud as you possibly can. And that's going to help you to process guilt, to process shame, or a traumatic experience that is stuck, because truthfully, trauma is in our body and want to help get it out.
How do people get a hold of you, Miss Jeanette?
So if somebody wants services through Aligned Empowerment, which is my own private practice, right, they can definitely reach me through email at j83james@yahoo.com, or I'm actually found on Psychology Today, which has my link to book an appointment. Now, if any of you listeners have a question, right? Maybe you don't want services, but you have a question. I'm definitely always up for answering questions. So you can also reach me at the same email at j83james@yahoo.com. And for those of you that are veterans, that are military, that are family of military, maybe you don't even know that the Stephen A. Cohen Military Family Clinic provides services to post 9/11 veterans and whom they define as their family, which means you don't have to be legally married. You could be the girlfriend, you could be the caretaker, you could be their related family. And if your situation is impacting that veteran, then you can actually access services through their DD 214 as well, through their service connectedness. So the phone number for the local office would be area code 915-320-1390. Again, that would be area code 915-320-1390. Or when it comes to the San Antonio office, it would be area code 210-399-4838. Again, that would be 210-399-4838. So please know I'm on social media too. I am that person that's there with my full name, Jeanette James. So I'm on Instagram, I'm on Facebook. And if there's any questions or anything that I can do to refer you to the right place, please do not hesitate to reach out, because I'm all about connecting you to the right service and definitely inspiring you to be a better you every single day.
Thank you. Thank you so much. Ladies and gentlemen, Miss Jeanette James, thank you for watching the Love, Health, Prosperity podcast. We'll see you next time.